has been so far that you may not be showing symptoms, you may not be symptomatic, so what's the point? And also that the virus is already here, so, you know, a few people coming into the country with virus don't make a difference. But why does testing people at airports make a difference, in your view?
Well, it has to be a complete package of interventions. So, yes, we've seen that testing people at airports is not the full solution, but actually the 2-week quarantine has been proving to be pretty effective in the countries that have been adopting this since January, February, and into March. Working in a cross-country context, if you want to keep your daily new cases low, you obviously have to watch the risk of importation of cases from other parts of the world. And it doesn't work to specify specific countries to say, oh, we don't want, travel from China or from Italy, because people move. They'll connect in Singapore or they'll connect in Dubai. So what you actually have to do is have a blanket 2-week quarantine, and this should have been, I think, put in place when we had, in early March, signs that this was going to be getting out of control.
And also the countries that have been islands in particular, because we're an island, when you look at New Zealand and Australia, they did do this at airports, very draconian. They basically isolated their islands and they've had extremely low death toll, certainly by comparison to us. So there's clear evidence that if you're an island and you locked down properly earlier, you did better.
Yeah, that's definitely true. I mean, if you look at the places that are doing really well, New Zealand is on track for elimination, Australia, Iceland, Faroe Islands. Basically, if you're able to watch your borders and aggressively go after the virus. But I think probably in March, the debate in the UK was less about how do we build a fence at the top of the cliff and more about how do we build hospitals and mortuaries at the bottom of, the cliff instead of protecting people from that. So that probably explains some of the difference.
Professor Sridhar, it wasn't just the UK, because when President Trump brought in measures to restrict those coming in, I put that point to Dr. Margaret Harris of the World Health Organization. I don't know if we've got that clip. Let's just have a listen to what she says from the World Health Organization. Beginning of March, the US president taking this action, banning travel from these European countries, doesn't include the UK and Ireland right now. Is that the right measure by the United States?
We are not keen on travel bans generally with outbreaks because it makes the country concerned focus more on managing their borders rather than focusing on what we'd like to see, the spread within the community, stopping the spread within the community, and really supporting the health system to be able to look after the people that are and do get severely ill.
Professor Sridhar, has the World Health Organization been giving the right advice?
Well, I think those remarks were in reaction to what President Trump was saying, which made no sense, which was that you could still travel from the UK, but you couldn't travel from European countries. As I said, it doesn't make sense to target specific countries. And those who did, for example, target China, the States and Italy were the first to see cases. And the WHO has changed. If you look at its recent advice on exit strategies, one of its key points is watching the risk of importation, because actually, if you're trying to get a handle on the virus, you obviously have to know when it's coming in.
Well, what we now know is it appears that the biggest number of deaths that have been reported now, obviously the reporting deaths are not the day before, they can stretch back quite a period of time, but the most intense period for fatalities in this country appears to be middle to end of March, which of course when we had decided as a country not to properly lock down until that very last week, and when we'd also made a decision to stop testing anybody outside of hospitals. So, Professor, looking at that, is there any doubt now that that was an error by the UK?
Well, I think too many assumptions were made early on that this virus would probably be like the flu and not a MERS or SARS-like event. We don't know yet enough about this virus. We don't know about immunity. We don't know about long-term health effects. We don't even know how it'll affect you individually, though we know at a population broad stroke, if you're older, you're more at risk. And so until there was more information, I think the imperative should have been keep numbers low, containment. And to do that, actually, you do need to have widespread testing, tracing of contacts, isolation of those who have the virus. You do need to have watching of borders, early lockdown, because the earlier you lock down with exponential growth in the case of this virus, doubling every few days, cases will just take off. So I think it was what was the objective early on. And it's clear that, if your objective was containment, then letting making that decision on March 12th was probably a mistake.
OK, let's bring in Simon Calder. Simon, you're a very seasoned travel expert. Your view has been that we should just continue to fly. Why?
Well, look, I think this measure that the government is proposing is simply too much too late. I actually came into the UK just before lockdown, and here's what happens at Heathrow. You get your lovely leaflet telling you what to do when you are symptomatic. And that's exactly the same as what's happening now. The only difference is that you're also told to keep 2 meters from somebody else, which is quite tricky to do in an airport environment. And you're told to go straight home and wait there for 2 weeks if you are at all symptomatic. And that is actually, I'm just following the medical advice. That's what the World Health Organization, that's what the European Centre for Disease Prevention and Control says. And it's all about resources. Let me give you a couple of examples. There are flights coming in today from Islamabad to Manchester, from Lahore to Heathrow. Those are repatriation flights with about a total of 600 British people on board. Now, yes, we could say to all of them, right, go home, stay where you are for 2 weeks. We'll be coming round and checking that you're not slipping out to the shops. But the incidence of coronavirus in Pakistan is 1/60th of what it is here. You'd be much better off going to Wilmslow High Street or Hounslow High Street and finding 600 people there. You'd have a much higher chance that one of them would be carrying the virus, but non-symptomatic.
I know, but Simon, the thing is, just because we're not testing everybody, I don't think is an argument for saying we shouldn't test those people we can or quarantine those people we should.
Oh, sure. Look, you can do if you want to. And the reason, as we were hearing, that Australia and New Zealand have been so successful is that they applied these things very, very early. And the World Health Organization says, yes, these things can help slow the spread if you apply them early. Once you've got local transmission, and very tragically we most certainly have here in the UK, it's simply a waste of time and resources. And perhaps somebody would like to tell me which NHS hospital we divert staff and PPE from in order to check people at Heathrow who have a lower risk.
Dr. Hillary, you want to jump in on this?
No, Simon's absolutely right that we should have done it earlier, but we should still do it now, in my opinion. I've just done some sums here. If we know that every person with COVID-19 can transmit it to 3 others on average, and that every 3 or 4 days, that is, and after 30 days you have 400 people from that one index case, we have 105,000 people arriving every week at British airports, and if just 5% of them coming in from places where they've got a prevalence of COVID-19, that's 2,100,000 cases that could occur 30 days later. Now, I'm just thinking of the NHS here and how the NHS is asked to cope with an extra 2 million cases, potentially. That's the worry that I have.